Hello and welcome to this Soton Anatomy Hub video covering the branches of the internal iliac artery, a tricky area with a lot of variability. Before we get talking about the vessels themselves, let's talk about some of the associated structures, most notably here the muscles which sit and line the pelvic cavity and sit in the background of the vasculature and the nerve supply. So the first muscle that we're going to talk about here sits in the background of the sacral plexus and its emergence through the foramina, and that muscle is the piriformis muscle. Its fibers run through the greater sciatic foramen and attach to the greater trochanter of the femur. The obturator interna sits slightly laterally and over the top of the obturator membrane. Its fibers stretch through the lesser sciatic foramen and are also attached to the greater trochanter of the femur. So therefore both muscles have the same action. When the thigh is extended, there is lateral rotation at the hip, but when the thigh is flexed, we get abduction at the hip. Levator ani is a group of muscles that sits on the floor of the pelvic cavity, offers integrity to the floor and contains the pelvic viscera. It's made up of pubococcygeus, iliococcygeus and puborectalis, and together with the associated coccygeus muscle which sits on top of the sacrospinous ligament. Now that we've covered the muscles that sit inside the pelvic cavity, we can move on and talk about the vessels. So we're going to be talking about the branches of the internal iliac artery. But first of all, what gives rise to the internal iliac artery? Well, it's the common iliac artery. And the common iliac artery comes from the abdominal aorta. So the abdominal aorta splits into the common iliac on either side, and then we get an internal iliac that crosses the pelvic brim and supplies viscera and structures inside the pelvic cavity, while the external iliac becomes the femoral artery. The internal iliac splits into an anterior trunk and a posterior trunk. The anterior trunk becomes the inferior gluteal artery, that's its terminal branch, and the posterior trunk becomes the superior gluteal artery. Both emerge into the gluteal region. Now let's talk about those individual branches, and to do that we need to find a reference point, and that is the sacral plexus, L4, L5, the lumbosacral trunk, and the ventral rami of S1 to S4. That's important for where those posterior and anterior trunks dive in to become their terminal branches. We'll talk about that later. Now the branches of the posterior trunk are quite straightforward. They essentially go to bone and soft tissue. Number one is going to be the iliolumbar artery, and that ascends out of the pelvic cavity and supplies muscle like the posterior abdominal wall and also the quadratus lumborum muscle. Number two, the lateral sacral artery dives into the foramina of the sacrum and supplies bone and soft tissues. So neither of these branches from the posterior trunk supply viscera. The branches of the anterior trunk are far more complex and variable. Now you'll see here that we have a female pelvis, so we'll be talking about the female branches, but mention the male branches where we need to. First of all, we've got the obliterated umbilical artery, which supplies blood up until a variable point until it becomes a fibrous cord. It gives rise to a number of superior vesical arteries that supply the bladder. The obturator artery is nice and easy to find. It follows the obturator nerve through the obturator canal and supplies the adductor group of muscles in the thigh. The third branch here is the uterine artery. A good way of remembering it is the saying water under the bridge. It actually crosses the ureter obliquely and superiorly to join the uterus, and in most cases that I've seen, a small number of vaginal arteries come from the uterine artery directly, although it can be noted that they come directly from the anterior trunk as well. Now both of those arteries are replaced in the male by the inferior vesical artery, which supplies the bladder and the prostate. The next branch that we see is one of the deepest inside the pelvic cavity. It is the middle rectal artery. It's one of the deepest there, but it stays inside the pelvic cavity to supply the rectum. There is a deeper artery, and that is number 6 here, which is the internal pudendal artery. That follows the course of the pudendal nerve, and it dives the medial side of the coccygeus muscle in order to travel through the greater sciatic foramen, hook around the gluteal region, and then enter into the lesser sciatic foramen to go into the perineum. Now here's a quick summary of what we've discussed. First of all, we must recognise that the internal iliac artery splits into two trunks, and those two trunks are the anterior trunk and the posterior trunk, the anterior trunk being the more complex of the two with numerous branches. The branches of the anterior trunk are highly variable, so we see lots of variation on the cadavers. They supply the pelvic viscera, and the anterior trunk terminates as the inferior gluteal artery, normally diving between S2 and S3 ventral ramus, although we do see variation. The branches of the posterior trunk are basically branches that go to bone or to soft tissue. They do not supply viscera, and there's only two of them, so a lot easier to remember. And this terminates as the superior gluteal artery, which dives in between the L4, L5 lumbosacral trunk and usually S1.